Time right now here on Live Impact News 1031, and the sudden death of Senator Lindsey Graham over the weekend has certainly put new attention on a condition many people never heard of or may have never heard of until it's too late, an aortic dissection. Joining us right now is Dr. Nishant Shah, cardiologist and associate professor of medicine at Duke University's Duke Clinical Research Institute. Doctor, thanks for joining us this morning.
Absolutely. Thank you so much for having me.
Let's talk about the basics first, and this term, aortic dissection. A lot of people have never heard of this before the weekend. What exactly is it?
No, that's a great question. So an aortic dissection is a tear within the wall of the largest artery that comes off the heart that supplies blood flow to the rest of our body. This is a medical emergency, and it can be very sudden due to oftentimes underlying genetic conditions or uncontrolled risk factors for heart disease.
Is this different then from a heart attack? Because people often use them interchangeably, right?
Yeah, it is different from a heart attack, and that is also a great question. Heart attacks typically happen when you have a blood clot or an obstruction in one of the vessels of the heart, blood vessels on the heart. The aortic dissection is a tear, either due to longstanding high blood pressure or a big dilated size of the aorta or a genetic condition. And sometimes that tear can also extend into the vessels of the heart that can mimic symptoms of a heart attack.
So Senator Graham's tear or aortic dissection was due to, and I'm not even going to try to mess with this term, I'm just going to call it ACD, cardiovascular disease. Can you explain that condition?
Yeah, no, absolutely. And what I can say is that I have not taken care of Senator Graham or was involved in his care, so I can't comment too much on the specifics of that case. But the condition that he may have had could be a condition that predisposes him to aortic dissection. So potentially he may have already had a dilated aorta. So what that means is that that large vessel was naturally already big. And so that increases your risk of a tear or a dissection, which oftentimes can sneak up on you very suddenly.
Would this be found out in an annual physical?
That's also a really good question. And oftentimes it may not. And so what we encourage patients to do is to understand their family history. Have there been anyone else in the family that has had an aortic aneurysm, for instance? That is another word for that dilated aorta. Is there anyone in the family that's had an aortic dissection? Because if you have a family history, that should start prompting your providers to screen for conditions like an aortic aneurysm or other things that will predispose you to a dissection. The other thing we encourage patients to do is to make sure their risk factors for heart disease are well managed. Examples include blood pressure, high cholesterol, diabetes. If they're smoking, they should stop smoking. All of these things together can create a process called atherosclerosis or plaque buildup that happens not only in the heart vessels, but also the aorta. And when you have atherosclerosis in the aorta, that also predisposes you to an aortic dissection. So one thing you can do on your physicals is make sure all of those chronic risk factors for heart disease are well controlled.
So you get those numbers when you take your annual blood test, cholesterol, blood pressure, things of that nature, and then to be put on meds. A lot of people are apprehensive in their middle to young senior age to go on something like a statin. What is the stigma or the fear around that?
Yeah, no, it's a question that comes up a lot. And I mean, I think, in my opinion, that is a fair question because all medicines have the risk of side effects. And certainly we don't want anyone to have any side effects with any medicines we choose, but statins and side effects that they have had have kind of created a lot of buzz on maybe more of a negative connotation towards them. What I would say is that have those conversations with your providers, show them what you're worried about, tell them, and then come up with a shared decision together on a plan that if you do have a side effect, what are the alternative therapies? More often than not, most people don't have any side effects to any of these meds. And when you think about conditions that could prevent something like, let's say, an aortic dissection or a heart attack or a stroke, oftentimes those things come up on you very suddenly, and you don't have much time to seek help. It's a medical emergency. And so it's much better to help control those risk factors up front so that you're more proactive rather than being reactive.
And then what is actually happening in the body during a dissection?
Yeah. So when you have a tear in that aorta, that big vessel that comes off the heart, what's happening is blood is starting to pool outside of the inner layers of the that blood vessel. So what that does is that it causes compression potentially of surrounding structures. It can leak blood into a sac around the heart, putting compression onto the heart. It can also cause the tear to extend not only into the vessels of the heart to cause heart attacks, but can also cause strokes as it extends to vessels to the brain. And so it's very important to get urgent help right away. I think sometimes people don't know that they're having an aortic dissection, right? It's something that can sneak up on you, but warning signs, certainly, of anything that's happening to the heart are sudden onset chest pain. Folks that could be having a dissection oftentimes complain of that pain radiating to their back. They describe it as sort of a tearing feeling. And so, as I mentioned earlier, the best case scenario is to not even get there in the first place, and making sure that you do a deep dive in your family history and control those risk factors for an aortic dissection early so that you never even have to worry about this.
Let's talk about age and gender. Do they play a role?
Yes. So the older someone gets, the more likely their body has been exposed for a longer period of time to potentially uncontrolled cardiac risk factors. So older age people are at a higher risk. In terms of gender, we don't really see too much of a difference on the gender side. Where I think a big component of this comes is in the genetics. So there are a lot of genetic conditions that can also cause aortic dissections, and so folks that are at younger age are at risk if they have a genetic condition, and oftentimes the indications for, let's say, surgery to prevent an aortic dissection, for aneurysms or those big dilated aortas for younger people with genetic conditions can happen sooner. And so getting to know your family history is very important.
And it is possible to catch this, right?
Absolutely. It is possible to catch this. You can catch it in stages before the dissection or the tear in the blood vessel happens. We obviously don't want a dissection to happen, but if there's any concern or suspicion, go get help right away. The faster you can get to emergency services, the better your chances of a good outcome. Oftentimes, if there's a dissection in the ascending aorta or the top portion of that blood, right above the heart where the blood vessel originates, they'll oftentimes take you right back to the OR for definitive treatment where they repair that before it gets worse. And so, the key here is obviously avoid getting there in the first place. But if there is a suspicion, get help immediately.
All right. And then what does survival outlook look like if caught in time?
If caught in time and you're at a center that can do these surgeries very proficiently, the chances of survival are very good. We've come a long way in cardiac surgery. Technology has developed a lot since we first started managing these. And so the people have a good chance of survival. And so you just got to get there and get help quickly.
All right. Dr. Shah, thank you so much. Anything else our viewers should know to potentially save a life?
Yeah, I think knowing the warning signs, anytime someone is having chest pain or sudden onset chest pain, please attend to them, help them get help. And I think the biggest thing here is trying to address your risk factors early. Want to be proactive and not reactive. Talk to your providers on ways that you can prevent a heart attack, a stroke, or a aortic dissection, because you certainly don't want to be in that position if you don't have to be.
All right. Great message for us this morning. Dr. Nishant Shah from Duke University's Duke Clinical Research Institute. Appreciate the conversation.
My absolute pleasure. Thanks for having me.
Thank you. And we'll be right back on Live Impact News.